episode, Am I Okay? Because I get a lot of questions about different scenarios or things that happen during intimacy, and a lot of you are wondering, is this normal? Should I see a doctor? And so I'm going to go through a few different situations where you're probably totally normal, or it might be worth talking to a doctor about. Doesn't mean it's not normal, but it might be worth talking to a doctor about. Okay, so first scenario. Tight foreskin or phimosis. Tight foreskin can cause painful erections or pain with peeing when the hole in the foreskin is not large enough to be retracted over the head of the penis and on the shaft of the penis. And so if this is you, it is worth seeing a doctor. It's nothing to panic about, and you're still pretty darn normal. But the only reason I would say talk to a doctor is because if you aren't able to do gentle stretching or retraction slowly on your own, a doctor can provide a topical steroid that can help loosen things up so that you can retract the foreskin a little bit more comfortably. If you are unable to achieve full retraction with use of a topical steroid after a certain amount of time, then it might be recommended that you go for circumcision, because the retraction of a foreskin is important for both cleaning underneath the foreskin, as well as if you're having painful erections, that's a problem. And so we want to help you through that. So that is scenario number one, painful erections. See a doctor. All right, scenario number two. You have a penis and you ejaculate very quickly. You worry, is this premature ejaculation or is this normal? The diagnosis of premature ejaculation requires a number of things. First of all, it has to occur generally within the first minute or so of penetration. Second, it has to happen multiple times, almost every time you have some sort of penetration, either vaginal or anal. And lastly, it has to cause some emotional stress or discomfort, or make you want to avoid having intercourse. And so, how do you know if this is a situation where you need to see a doctor or if it's something that's normal? Generally speaking, the first number of times that someone has stimulation of the penis with penetration, it can be very normal to ejaculate very quickly. So give yourself time and be patient. It can take some time to get used to that feeling and be able to last a little bit longer with intercourse. That being said, it's also not a big deal if you ejaculate in under a minute every time and it doesn't cause you problems. So the only real reason to see a doctor for ejaculation quickly would be if it happens almost every time with vaginal or anal penetration, ejaculation happens under a minute, and it causes you severe distress. Otherwise, it's totally fine. Nothing concerning. All right, next scenario. Losing an erection or inability to get an erection that is sufficient enough for vaginal or anal penetration. Another situation where a lot of folks worry, is this erectile dysfunction or is it normal? In a young person, this is rarely something that a doctor needs to evaluate. It is very common for many factors to contribute to inability to maintain an erection or to get a good erection the first few times. It is also very common for mental conditions such as depression, anxiety, or relationship issues to interfere with the ability to get or maintain an erection. And so if that is you, certainly talk with your doctor. But erectile dysfunction is mostly a situation for individuals who are quite a bit older with male anatomy. So statistics show that about 18% of individuals over 50 identify with some form of erectile dysfunction, and that proportion goes up the older you get. But the younger you are, there's really unlikely to be anything anatomically wrong with you. Usually causes of erectile dysfunction that can be helped or reversed would be cardiovascular problems, so like heart disease or diabetes. Other things that can contribute to problems with erections are going to be medications or drugs. So if you're on a medication like an antidepressant or a blood pressure medicine, it's definitely worth talking to your doctor about if you're having a hard time with erections, because it might be drug induced. And so we could talk to you about potentially other options. Other drugs as well, cocaine, heroin, marijuana, have all been linked to problems with erections as well, so keep that in mind. And then a lot of folks wonder if testosterone is low and if that is the cause of erection problems in a young person. Generally speaking, it is not. It's certainly worth talking to a doctor if you continue to have problems getting or maintaining an erection, and we could test your testosterone. However, that is rarely going to be the cause of erectile problems in a young person. It generally goes back to mental health or relationship issues. And then one more thing that's sort of controversial but worth talking about is bicycle riding. So if you're a very intense bicyclist, there are some theories that a lot of pain or pressure on the nerves down there for prolonged periods of time can cause some problems with getting or maintaining an erection. So if this is you, potentially talk to your doctor about it. Next scenario, bleeding vaginally the first few times of vaginal penetration. This would be a scenario that is unlikely to need a doctor's evaluation. That being said, if you do have an episode of bleeding that lasts longer than 24 hours, or if you're experiencing heavy bleeding, that is not your period, but something else that may have been torn, it would be worth talking to a doctor about to make sure that you don't have a bleeding problem, like a clotting disorder. But generally speaking, things that cause bleeding after the first few times of vaginal penetration are going to be hymen tearing and then repeated trauma to that scarring or healing hymen tissue. Sometimes vaginal irritation can cause some bleeding. And then potentially, if you're using a condom, latex allergies, so irritation of the vaginal canal can also cause bleeding. But on the flip side, if you have bleeding with vaginal penetration and you've had intercourse many times, it's possible that that is related to a sexually transmitted infection. So irritation of an infected cervix can cause some bleeding. So that would be worth seeing a doctor. And then the other situation that I get a lot of questions about is bleeding with orgasm. And this is the particular scenario of you have had intercourse, you have had orgasms multiple times, and you bleed every time. In that situation, it would be worth talking to a doctor. It is possible that you are orgasming close to your period, and that releases a little bit of extra blood flow, but there are some conditions that orgasm and contraction of the uterus can release some blood, and so that would be worth having a doctor evaluate and make sure there's nothing going on with the uterus. But there are a portion of people with female anatomy, so don't panic. There are a portion of individuals who experience a little bit of bleeding with orgasm, and we don't know why. So don't panic if this is you, but if you are someone who experiences vaginal bleeding with every orgasm, it's worth talking to your doctor just to make sure there's nothing else going on. But again, don't panic. This happens. All right, so this is my first round of sexual health scenarios that might be totally nothing or might be worth talking to a doctor about. But generally speaking, young people are pretty darn healthy, and it's rarely a situation that you need to panic about. So I hope this helped. And remember, if you have a question for Ask Dr. T, you can either respond in this video or submit through my website, askdrt.net.